Hello, everyone, and welcome to our annual training on claims management, drug-free workplace, and some personal protective equipment. My name is Mike Wolf from the North Dakota Association of Counties and the County Employer Group. And first of all, I'd like to thank you for taking time out of your busy schedule to attend our training today. This is some mandatory training that we have to conduct on behalf of our insurance company, Workforce Safety and Insurance, as part of our safety program with them. So we will get into our training session today with the claims management portion. First of all, people ask us, when am I covered under workers' compensation insurance? And basically, it's any time you're conducting work in the course of your employment, doing something that your employer requires you to do. You're not covered if you leave the work premises on breaks or for personal reasons. So we'll talk about incidents in the workplace. Incidents are anytime an employee might have some type of an injury, maybe an accident, maybe you have an exposure to such things as a bloodborne pathogen or chemicals, but it's not bad enough that you need to go seek medical attention. So you might be walking down the hallway or walking down the steps or getting in and out of your road grader or your vehicle, and you twist your knee or you twist your back and you say, I can feel a pain in my back or my knee, but it's not bad enough that I need to go see a doctor. We need to report that to Workforce Safety and Insurance within 24 hours so that we can document that something happened to you in the workplace. So you need to follow the reporting procedures your county has set up for filing incidents with Workforce Safety and Insurance. And if you don't know what those are, make sure that you contact your supervisor or your risk manager to find that out. And always make sure that both your supervisor and risk manager know that an incident has occurred, no matter who's responsible for filing the incident, because we may need to make some accommodations for you. If you twisted your back and you lift things throughout the course of the day, we might want to make some accommodations for you to make sure that you don't injure yourself further. So we always tell people nothing is too minor to report for an incident. Your county is not penalized in any way when incidents are filed with Workforce Safety and Insurance. In fact, they encourage that so that we can document if something's happened to you in the workplace, so that if later on maybe that twisted back or knee doesn't get better and you do need to go see a doctor, then we have documentation that something happened to you in the workplace. A lot of times county employees work by themselves or aren't always witnesses to accidents that occur in the workplace. So that's why it's very critical that you document that something's happened to you. And delayed reporting and not reporting that only jeopardizes you if you do need to go see a doctor later on because your back or knee didn't get better. And now the burden of proof is going to be placed on you to prove that something happened to you in the workplace. So even small things like cuts and lacerations, people might think it's very minimal if somebody cuts their finger to file an incident report, but we need to file an incident report. We've seen those type of situations turn into infections. And then when an employee wants to go get treatment for that infection, they didn't report an incident when it initially happens, and their claim was denied by Workforce Safety and Insurance because it was 2 weeks later, and Workforce Safety and Insurance said that that could have happened anywhere. How do we know it happened at work and there were no witnesses to that employee's injury? So don't think that you're bothering anyone to do it. It's a very simple, easy process. For those who will file that incident on your behalf, it probably only takes about 2 minutes to get that done and documented for you online. And as I said, we might have to monitor your condition and make some accommodations for you until you're fully healed. Okay, now we've got a situation where an injury occurs and you do need to go see a doctor. Maybe it's something that just happened today and you need to go see a doctor right away, or maybe it's because that incident that happened 4 days ago that now you do need to go seek medical treatment. Again, we need to follow the reporting procedure your county has set up for filing claims, as well as incidents with Workforce Safety and Insurance. Okay, make sure your supervisor and risk manager know that you're seeking medical treatment for that workplace accident, if it's a result of your incident that happened a few days ago, or it's because of something that just happened today. So if we don't report that injury of you going to seek medical attention to Workforce Safety and Insurance within 24 hours, Workforce Safety and Insurance will penalize and fine your county $350 for not reporting your injury and you going to seek medical attention within 24 hours. So it's very critical that we do that. And again, it's for your benefit that that happens, because your injury gets documented, and once the medical bills start coming in and medical notes come in, your claim can be processed that much quicker and easily, and your medical bills get paid that much quicker as well. We also need to complete an accident investigation within 4 days. We do that online. It's a very easy process, and generally the supervisor in the department of which the injury occurred is responsible for filing that accident investigation, and we are here to help with that. We can help anyone file that accident investigation online. So if you do need assistance with that process, make sure you reach out to your risk manager, who will reach out to us, and we can certainly assist in that process. And again, if we don't complete that accident investigation within 4 days, that's another basis for Workforce Safety and Insurance to penalize the county with that $350 penalty. So we need to do both. We need to have 24-hour reporting, and we need to complete an accident investigation within 4 days. And depending upon the nature and severity of that injury, or if there's circumstances where a supervisor, the employee is going to be out for a while on vacation or something, we can extend that and make sure that that works. You just need to communicate that with us. Now, if we have shift and weekend work, we have until Monday morning to file that incident or that injury claim if it happened after 5 o'clock and before 8 o'clock on Monday, or Tuesday if Monday's a state holiday. So if you're injured at 2 o'clock on a Saturday afternoon, maybe the road department got called in to plow some snow and you got injured, we have until Monday to actually file the paperwork, but we still need to know that you got injured at 2 o'clock on Saturday afternoon. And if you went to see a doctor, we need to wait until we get those medical reports from that doctor before we can let you come back to work, because if that doctor placed some restrictions on you, we don't want you to come back and put yourself in a position where you're going to hurt yourself even further. So that's why it's very critical that you need to notify your supervisor and your risk manager over the weekend that something happened. If we have social service people that get called in over the weekend, we have law enforcement that works weekend shifts. So if something happens to you on the weekend, even though the paperwork can wait until Monday morning, we still need to know, and you need to contact someone to let them know that that incident occurred and you didn't seek medical treatment, or that an injury occurred and you did go seek medical treatment. So we'll talk a little bit about our designated medical provider program. It's a mandatory program through Workforce Safety and Insurance that employers have to participate in. And it's a program where the county, the employer, has to designate certain medical providers that employees must go see for their workplace injury accidents. Okay, you have to go to that designated medical provider. If you don't go to the designated medical provider, it's a basis for workers' compensation to deny your claim. So this portion of the training is very critical, that you understand who your designated medical providers are, so that you go to a designated medical providers in the event that you're injured at work. Now, if there's emergency care and you need to be taken, for example, by ambulance someplace out of your provider network, that does not fall under the designated medical provider program. It's more important that we get you the best medical care as quickly as possible. Now, even though the county has selected some specific designated medical providers, you also as an employee have the option to select your own designated medical providers in addition to those that the county has selected. So who are designated medical providers? Basically your medical doctors, clinics, hospitals. They can be ophthalmologists, optometrists, dentists, but one that we really recommend that you add to your designated medical provider form, if the county hasn't selected one, is your chiropractor. A lot of counties do not designate chiropractor as a designated medical provider because there's too many in a county, and so they can't choose every single one of them. So the county will default to the employee to list their chiropractor as an additional designated medical provider. So here's the designated medical provider form that you have to fill out every year, and it's usually around this time of year. Your risk manager will provide this form to you, and in the upper portion of this form, it will list the designated medical providers that the county has selected. Now, you may look at that form and you say, okay, I go to those medical facilities, everything's fine. I don't need to add any additional designated medical providers. But if you look at that form and there's no chiropractor listed there, and you've gone to a chiropractor in the past and you feel chiropractic care is beneficial, you should definitely list your chiropractor in the lower 2/3 of that form. Because if you don't list your chiropractor, you cannot go see your chiropractor for an initial workplace accident. And what do you think the odds are of a medical doctor referring you back to your chiropractor if you ask them? Probably little or none. They're going to refer you on to an orthopedic specialist. Now, if you list a chiropractor on here, it doesn't mean you have to go to the chiropractor for your workplace accident. It means you're giving yourself an additional option to do that. And it would depend upon the nature of that injury, which dictates where you would go and what medical facility you would go for your workplace accident treatment. Now, let's say you've never had chiropractic care in the past, and maybe you had to go see a chiropractor for a non-work related situation, and you said, you know, that chiropractor did a pretty good job. If I ever get hurt at work, that would be a good option for me to go see a chiropractor. Now, even though you sign off on this form on a specific date, that form is good for a 1-year time period. And so you can come back at any time throughout the course of the year and add an additional designated medical provider. When you sign off on this form, it doesn't mean you're locked in with those designated medical providers for the coming year. You can come back 1, 3, 6, 9 months later and say, I would like to add an additional designated medical provider, and you can do so. And then you have the option to go see that designated medical provider if you're injured at work. Now, if you don't add that, then of course you can't go see that additional designated medical provider. So if you have any questions on this portion of our training, a very critical portion of our training, contact your risk manager. They're well trained in this area, and they will be able to assist you in the designated medical provider process. Okay, now we're at the doctor's office, and there's a very important form that we need to get from that doctor every single time you go see a doctor for treatment. It's a doctor's report of injury. It's a capability assessment report. It's a workers' compensation form. Some medical facilities have their own capability assessment forms, as long as it has the pertinent information that we need. And what this form does is it determines what your medical capabilities and or restrictions are. We tell people don't leave the doctor's office without it, because we can't let you come back to work without this form, because if we don't know what restrictions, if any, the doctor's placed under you, we certainly can't bring you back into the workplace and put you in a position that you're going to hurt yourself further. Now, getting that at the doctor's office sometimes is easier said than done. Doctors get paid to see patients, not fill out paperwork. So they fill out paperwork at a later time, maybe later that day, maybe the next day. And in that meantime, we can't let you come back to work if we don't have that form. So if you don't get it, come back to work. Tell your supervisor, the risk manager, you couldn't get that form from the doctor's office. Your risk manager will get a hold of Jennifer Mormon, our internal claims manager here at the CEG, and she has a great working relationship with all the medical facilities throughout the state, and she will get that for you virtually the same day. Because if it takes 2 or 3 or 4 days to get that form from the doctor's office, remember, we can't let you come back to work if we don't know what the restrictions are. Now you're going to have to take 2 or 3 or 4 days of vacation leave, and we think you can utilize your vacation leave much better than waiting for a doctor's report to come in. So if you don't get that, make sure you get it. And make sure you understand what those restrictions are, because you have to follow those both on and off the job 24 hours a day, 7 days a week. A lot of people think, well, I got injured at work, so I only have to follow the restrictions while I'm at work, but that's not the case. If the doctor places a 25-pound lifting restriction on you for the next 2 weeks, last thing you should do when you go home is lift something more than 25 pounds, because if you do and you aggravate or re-injure yourself as a result of doing that, that's the basis of workforce safety denying your claim from that point forward. And make sure the doctor understands what you do for your job duties so that they can uh, apply the correct restrictions to you if they think that's necessary. And remember that we need a capability assessment report after every doctor's visit. Your risk managers have access to these forms, so if you're going back for a follow-up visit, get one of these forms from your risk manager, and if you hand that to the doctor at the doctor's office, there's a higher likelihood that they will fill that out and complete that for you so that you can bring that back to your risk manager and your supervisor so that we can follow those restrictions. And they may lift the restrictions right after another follow-up visit. They could eliminate those restrictions and you could return to full duty. We'll talk a little bit about our transitional return to work plan. The County Employer Group has probably the most comprehensive transitional return to work program in the state of North Dakota. When we started this program, we really did our homework. We went to every county, we talked to supervisors, risk managers, department heads, and we developed a big, thick manual full of hundreds of potential transitional jobs that people could come back to work and do that meet the restrictions that the doctors placed under you. And a transitional return to work program is for those people that might be injured a little more severely and they can't come back to their regular duties for a certain period of time, maybe 2 or 3 weeks. So what this does, it's a process where we bring people back to work as quickly and as safely as possible in those predefined temporary job assignments that we've developed over the course of the years. And we start within your own department, right? If you're in the road department and you hurt your back or shoulder or something and you can't drive your road grader for the next 2 weeks, is there something in the road department that you could do in the shop or something else? If not, then we're going to look at another department within your county and say, is there something available that you could do that meets the restrictions that the doctor has placed you under? Okay, nobody determines when or how you will come back to work except your doctor. We work very closely with your doctor. We present them with potential transitional jobs that fall within the restrictions that the doctor's placed you under, and the doctor will sign off on those. No one else does. The CEG doesn't, your supervisor, the risk manager, no one else signs off on a transitional job other than the doctor. And it's been proven that people who return to work in some capacity heal quicker and get back to their regular job duties much quicker than somebody who would go home and sit around for 2 or 3 or 4 weeks and not do anything. So doctors will tell you that work is therapy. Doing something is better than not doing anything at all. So we'll work with meaningful job descriptions and find a transitional job that meets those restrictions and something meaningful that you can do. We're not going to bring a road department employee into the auditor's office and have them do data entry work if they're not used to being on computers all day. So that's why we have multiple options that we can work with. And the success of our program focuses on the employee's capabilities, right? We look at what somebody can do rather than what they can't do. And that's why our program has been successful. I think too many times people focus on what somebody can't do instead of what they can do. And that's exactly what we do, is we're going to focus on your capabilities and find that transitional return to work job that fits you. So what are the benefits of doing this? We've heard employees say, well, why are you rushing me back to work? I got hurt at work. Shouldn't I sit at home and rest and relax and get better that way? The main benefit for this program is that you get to maintain 100% of your earning potential through any transitional job you come back to. It doesn't matter if there's a difference in pay grade, you're going to continue to earn 100% of your salary. If you go on workers' comp disability benefits, they only pay 66 2/3% of your wage. Okay, you just took a 1/3 pay cut to go on workers' comp disability benefits, and that causes financial hardships for people. To top that off, WSI has a benefit cap, and they're only going to pay X number of dollars as a maximum benefit. And most of our county employees make enough money in salary that they're affected by that maximum benefit cap. And we've seen people lose up to 40 and 50% of their salary, and that definitely causes financial hardships. So through this program, you continue to earn 100% of your salary no matter what transitional job we bring you back to. Personally, I hope you never have to use this program, because if it does, it means you've been injured at work to the extent that you would need this. But at the same time, if that would ever happen to you, you will know that we've got a program in place to bring you back to work as safely as possible, and that you're able to continue to earn 100% of your salary. So we'll move on from our claims management program to our personal protective equipment. We want to be proactive versus reactive. I think too many times people don't think utilizing personal protective equipment is important until after something's happened, right? Now somebody's been injured and hurt, and then all of a sudden it's important that we need to get somebody some safety glasses or some latex gloves or whatever the case may be. Right? So if you don't have the personal protective equipment you think you need, don't be afraid to ask for it. And if you have it, please, please, please use it. Okay, utilization of personal protective equipment starts at the top. If commissioners, department heads, and supervisors don't think utilizing personal protective equipment is important, how in the world can we expect our employees to think that utilizing personal protective equipment is important? So if you have a supervisor or department head that doesn't care whether you wear latex gloves, whether you wear goggles when you're grinding, whether you're wearing safety vests, whatever the case may be, you should not do it just because of that. You should be the example, you should be the trendsetter, and you should always wear personal protective equipment, because our goal and your goal should be the same, that we all get home every single day safe back to our families. And so that's why we stress the utilization of personal protective equipment. Counties have done a really good job in providing the personal protective equipment employees need. Now all we need to do is get people to wear and utilize personal protective equipment on a consistent basis. We have a grant that we offer to counties. We've done it since 2018, and we've put hundreds of thousands of dollars back into county government in free personal protective and ergonomic equipment. So we can get vests, we can get jackets. For our road department and our law enforcement, class 3 vests and jackets are the only vests and jackets we will get. It's the highest class, the highest quality, and we want to make sure that our employees are properly protective. Here's a lot of other personal protective equipment that we utilize in county government through our grant and through counties just purchasing that equipment for their employees. We have anti-vibration gloves for our road departments, of course, latex gloves for our social service people and anybody else who needs them. Welding gloves, work gloves. Ice cleats are a big thing. Ice cleats for shoes and boots. We've pushed the utilization of ice cleats very heavily the last few years, and we've put hundreds and hundreds of pairs of ice cleats out in the workplace. And the key to ice cleats then is to utilize them, right? And we get the kind that are very simple. They're not slip over your shoe or boot type of ice cleats that are very cumbersome when you get in and out of vehicles and walk indoors and outdoors. We get the midsole ice cleats that are very easy. You put them on your shoe or your boot. When you're outside, you flip them around so the spikes are on the bottom. And when you walk into indoors or you get back into a vehicle, you simply spin them around and you spin the cleats to the top, and then you can walk normally on floors and operate your vehicle. So very effective form of personal protective equipment. We've had some ATV rollovers this past summer, some very serious ones. We almost had an employee get killed. So it's utilization of proper personal protective equipment when you're using your UTVs and ATVs. And in the lower picture to second from the right, we have now started utilizing fentanyl protective gloves. These have been tested against fentanyl, and they can be a very good resource for our social service and law enforcement employees. Now, we're not saying that everything is 100% protective, but they've done testing on these gloves so that when law enforcement are doing personal searches on people or searching vehicles, and when our social service people are going out on specific home visits, that here's another layer of protection for them. We gave some of these fentanyl protective gloves to all of our risk managers to bring back to our law enforcement and social service people when we just recently held our regional risk manager meeting. So just another level of protection that we can give our law enforcement and our social service employees. We'll finish up with our Drug Free Workplace. It's another mandatory program through our safety program with workforce safety and insurance that we have to train on and that we have to have enforced in our counties. And it starts with an EAP program, an employee assistance program. There's a formal and informal program. Formal means the county contracts for services with an EAP professional, and it's a paid benefit for the employees by the county. An informal one means that the county still has to contract for services, but it's not a paid benefit by the county. Employees are notified of who that EAP provider are, and it's posted on all of your bulletin boards because it's a confidential situation. We don't want employees going to the HR person or the auditor or a supervisor and saying, hey, who's our EAP provider? I want to contact them. That's a private situation for you, and employers do not know who utilizes an EAP program. So that's why that information is posted on a bulletin board. Here are the employee assistance program designees for each county as of 2024. So this information is posted on a bulletin board, and it should be on every bulletin board in your county, in the courthouse, and in outlying offices as well. And as I said, it's a confidential, 100% confidential, and it's not only for drugs and alcohol, it can be for personal reasons as well, and it's a very great benefit for employees. So talking about drugs and alcohol's impact in the workplace, if you remember about 5 years ago, we trained heavily on the use of opioids, and opioids were the talk of the town. And today we don't hear as much about opioids because all the talk now is about fentanyl. And in North Dakota, the fentanyl-related deaths are continuing to increase. I think every day when you pick up a newspaper or watch the evening news, there's something on the news about drugs, and it's usually about fentanyl. In 2019, 42% of deaths tested positive for fentanyl, while in 2023, that number rose to 77%. So you can see the increase in that. In 2023, North Dakota had 113 drug-related deaths, and 87 of those were fentanyl-related. Even in the workplace, and this is nationwide, overdose deaths have increased 536% since 2011. And I know we think that we're fairly good in our counties and we all have good people and all our people are good, but we're not unlike any other employer in the country or in the state of North Dakota. We deal with drug and alcohol issues in county government more than you would ever imagine. And so it's an awareness that we have to raise, and we have to talk about that and have policy and procedures in place. And people who are under the influence of drugs or alcohol on the job are 3.6 times more likely to be hurt on the job. Here's some examples of why fentanyl is more dangerous than heroin. Fentanyl is 50 times more powerful than heroin, and 2 milligrams, which is the size of 4 grains of salt, can kill you. And you look at heroin on the left, fentanyl and carfentanil, those are the doses that it takes to kill you. And carfentanil is 100 times more powerful than fentanyl is. It's actually used in such things as an elephant tranquilizer, and 2 milligrams would take down an elephant, not kill it, and 2 milligrams would kill approximately 50 people. So what are people doing to their heroin? They're lacing fentanyl in the heroin. And do you know what a person would be getting when they get that heroin from somebody? So here was an example we ran across where on the left they have a container of sugar, and on the right they have some blue crystals which represent the fentanyl. So then they mix it together and then they spread it out and break it out into their individual doses. And that's where it comes into play. Does a person really know what they're getting, right? As you can see in the bottom photos, one dose has very little fentanyl in it, and the dose on the right would definitely be a lethal dose, right, if you got that. So that's the dangers of fentanyl when they mix it with other drugs, is people really don't know what they're getting. And the use of fentanyl and the exposures to fentanyl really do affect our county employees. And the county employees who have the highest exposure are primary, our law enforcement and their canine partners and social services. We've heard about stories nationally where the canine partners came into contact with fentanyl and died. We've had law enforcement officers in the country who just get fentanyl on their skin and have a reaction to that. And so we want to make sure that people are protecting themselves, right? Wear the proper personal protective equipment for whatever job you're going to be doing where you think there could be a potential exposure to drugs, including fentanyl. So wearing masks if you need to, the fentanyl protective gloves, we can assist you in ordering those. They're not expensive. And the cost that you would invest in having those available to county employees is well worth the consequences if somebody had a fentanyl exposure. Wearing long sleeves, disposable gowns, safety glasses, there's a lot of precautions people can take. And the problem with personal protective equipment sometimes is people become complacent, right? They said, well, I've done this 100 times before and nothing's ever happened to me. I might not be doing it correctly, but I've never gotten hurt before, so why should today be any different? And today could be the day that maybe you didn't have that personal protective equipment on and you had an exposure, or you didn't use a proper protection and have the proper PPE on and something did happen to you. So don't become complacent and don't think you look weird or you're being weird because you're protecting yourself. You're doing it for a reason, and more importantly, you're doing it for your family. So every county has to have a drug testing policy and alcohol testing policy, starting with pre-employment. One of the most important things that you can probably have in a pre-employment testing policy, because if we can keep people out of the workforce before they come into it and they have a drug and alcohol problem, we've just done the rest of the employees a great favor. Post-accident or incident testing, if you have moving vehicle violations, we definitely have to have drug and alcohol screening after every one of those. Okay, and they say, to what severity should the accident be before we do drug and alcohol testing? There is no severity limit. If there's a moving vehicle violation of any sort, we need to have a drug and alcohol screening. Even if you bump into a post in the parking lot at the courthouse or at the shop, even though nobody got hurt and there wasn't any real vehicle damage, do you still drug and alcohol screen for that? The answer is yes, because we don't know if that person's under the influence of drugs or alcohol. And what if they leave the courthouse or they leave the shop yard in 10 minutes they're in a head-on collision with a county resident? Now we've got a serious accident and we've got a serious liability issue for the county as well. Random testing, some counties do random testing for all employees in safety sensitive jobs. And reasonable suspicion is the minimum you can have. And reasonable suspicion, if utilized correctly, can be very powerful tool in your drug and alcohol testing policy. People just need to take the initiative to initiate reasonable suspicion if we feel somebody's under the influence of drugs or alcohol. So what should you do if you're an employer, the supervisor, department head, or an employee who has a coworker, if you suspect they're under the influence of drugs or alcohol? The biggest thing we can tell people is you need to document it. Document it as an employee and give it to your supervisor. As a supervisor, you document as much as you can before you address the situation. But sometimes there isn't time to document stuff, right? You might need to take care of something right away today, so there's not time to document. So don't make accusations. That's why documentation is very critical. Be specific when you talk to somebody about it. Utilize your human resource department for knowing the laws of what you can and cannot do. Know what your drug-free work policy says, right? And know where your drug and alcohol testing can be done. We have a great benefit in county government because a sheriff's department could administer a breathalyzer test to an employee if a supervisor came to them and says, we're under the suspicion that this person's under the influence of alcohol. So what a great resource counties have that other employers wouldn't have if somebody wanted to initiate the reasonable suspicion portion of their drug and alcohol testing policy. And whatever you do, you have to follow through with your plan, right? It's no good to have a drug and alcohol policy if someone tests positive and you don't follow through with what your policy says as far as the penalties associated with testing positive. So how do you document that reasonable suspicion? Again, you receive complaints as a supervisor, you document that, assess the situation. Maybe you observe the employee. Maybe you don't have time to observe them. Maybe you have to go out right then and there and take care of things. Okay, always remove that employee from safety sensitive areas. Send them to testing if necessary, and always prepare that transportation. Never let that person go alone to that testing procedure, and then wait for the results and respond accordingly to what your drug and alcohol policy says you can do and what the penalties are for a first offense, second offense, whatever the case may be. Some have zero tolerance. Some counties have zero tolerance if you test positive for drugs or alcohol. One thing you really need to do is document and respond to an employee's refusal to take a drug or alcohol screening test. Okay, and you need to let them know the consequences, and you should have this in your drug and alcohol policy, that if someone refuses to take a drug or alcohol test, that's considered a positive test, right? Because if you don't have consequences to somebody refusing to take a drug or alcohol test, what's the purpose of having a policy? And then you can just have people under the influence all the time without any consequences. So that's an important part that you should have in your drug and alcohol testing program. So what would you do if you had a coworker who you suspect is under the influence of drugs or alcohol? Would you report it? Would you ignore it? A lot of people unfortunately ignore those type of situations. They don't want to get involved. They think it's going to cause problems, and they want to avoid conflict at all costs. It could be their best friend, right? And they don't want to deal with that. But if that is your best friend, then we need to address that, right? County employees do a lot of things together. People are friends in county government, not only with your coworkers, but with supervisors, department heads, commissioners. And so we shouldn't ignore those things if people are our friends, okay? Because if we do, we cover for their poor productivity, we cover for their mistakes, we make excuses for them, and then eventually something bad's gonna happen, right? And pretty soon they're going to have a workplace injury. Or we've seen cases where it's like a drunk driving accident. It's not always the drunk driver that gets hurt, it's the people in the other vehicle that get hurt. And that happens in workplace accidents when people are under the influence of drugs or alcohol. Their carelessness has caused their coworkers to get hurt. And so that's why we need to get involved, and we want to do it. It's not to get anybody in trouble, right? We want to get this situation taken care of to help that person and to continue to keep your workplace safe. So if you know about things, please report it. If you have trouble and you've reported it before and nothing's been done in your county, always know that you have the CEG to come back to, and we will assist you anonymously in any way that we can. So with that, that's our training for today. Again, I'd like to thank you for taking time out of your busy schedules. Always remember that you have a designated risk manager in your county. They do an excellent job. They're well trained. They're highly trained in our program, and they know exactly what to do, and they know that they have us as a resource as well, and you have us as a resource as well. You can contact us at any time. My contact information is on there. Jennifer Mormon, our internal claims manager, Patrick Engelhart, and Michael Casey. We're all here to help you in anything that you need to help make our workplace and county government a safe place to be. So with that, thanks again, and always remember to work smart, work safe. Have a great rest of your day.